We have another question from social media, Dr. Ned. Someone is asking, does NHI allow for overseas specialist treatment?
That's one of the areas that we're having some discussions. Now, the way we've designed NHI is that we have a three-tier system. The first tier has all of the services that are offered from the government dollars. The second tier has services that are generally offered from the private insurance companies. However, the people in the first tier have the ability to access those services in the second tier. The third tier is what we call the catastrophic tier. That's when something majorly is wrong with you. There are some options that we have where a country could buy a policy for catastrophic illnesses, a certain percentage of dollars put into that pot, and then you buy an insurance policy where people could go overseas and get care. Ultimately, that's where I believe we should head with the national health insurance. Okay? And that's a next level of coverage that a country could have. Today, when we start NHI, we'll not be able to do that. But some countries allocate a certain amount of dollars, right? Or up to a certain amount of dollars that if overseas care is needed. Within the NHI, we believe that we'll be able to do something like that. Philanthropic dollars, funds that we raise from other sources could contribute to that. People, their health savings account could contribute to that. There's lots of ways that can happen. I believe that the NHI will contribute a portion of that, but when we start off, we're not going to be able to do the whole thing just because of the resources. Certainly, the people that have private insurance may have a part of this as their policy that they pay insurance for. Now, we are proposing primarily for the people that are not insurable, that want to buy insurance, an NHI insurance policy. So they could buy the insurance from the NHI that would give them some of those services that they would need if they go overseas. So that possibility would exist. We want to make that available for people that want to buy it, they could buy it, and so forth. So again, we don't want to limit people. And the whole idea is that if we control the payment of those dollars to overseas, guess what? NHI could keep some of those dollars for administering the care or doing the navigation and so forth. So again, it'll be a benefit for, even though people leave the country, some of those dollars could stay into NHI for things like administrative costs, for the third-party administrative services. So there are many ways that we could make this an opportunity. So yes, people, in fact, we've been in that business. Our corporation, we have a network. JIPA Network is a network of hospitals and doctors throughout the US, Latin America, and the Caribbean. And we have arrangements. That's part of our business. We manage medical networks. So we already have a system that people throughout the Caribbean use to be able to access catastrophic care. And they could get it from the most expensive to the least expensive. So clearly, we hope to implement a similar system through NHI to be able to help people in the region, in Grenada, find access to those. The thing is, if you're going to buy healthcare as an individual, the cost is extremely high internationally. But if you buy it as a group, you'll be shocked at the level of discounts. You could be paying 30 to 40% of the entire care if you buy it in a group, compared to paying 80 and 90% if you buy through a group. So again, NHI will become a buying group, and that's what we want to do. Similar for pharmaceutical services and so forth. Those are the areas that we could actually impact. And a point of pharmacy, that's a huge part of the Grenada expenditure. Okay, Grenada spends a lot of money on pharmacy. I think it's approaching 15 to 20%. And just by managing pharmacy costs, creating a formulary that says these are the drugs that we're going to pay for. If you want to get additional drugs, you certainly could get them, but there are additional costs. But all countries, all insurance plans have formularies that they use of certain medications that they approve on their list. We need to have something like that in Grenada. Those are the things that helps you manage healthcare. So that's an example of how we can immediately save money and people will get access to the drugs they need. So right now, if your pharmacy system is disorganized, you are spending way more money than you should. And we're going to work with the private pharmacies. We're going to work with the public pharmacies to be able to set that system up. And that's why you need the partnership between the public and the private sector to make those things happen. If you do it purely as a public system or purely as a private system, not going to happen.